afternoon, everybody. I'm Shelly Chopra. Welcome to a new episode of Lumina Leadership Insight series. It's my pleasure today to be here with Dr. Jim Logan. Thank you.
Thank you for having me. It's an honor to be here.
Our pleasure. So Dr. Logan is a board-certified physician in aerospace medicine with 22 years stellar career as a flight surgeon with NASA. Totally starstruck there, but we'll talk more about it. Dr. Logan has supported several direct missions with astronauts and their teams as they've gone into the space. During his long tenure at NASA, he was also overseeing several other operations and got interested in telemedicine, and through that, you're actually one of the founding board members of Telemedicine Association.
The American Telemedicine Association.
And besides having worked at NASA, you've also worked with healthcare organizations across the country and many physician organizations in consulting with them and guiding them on how to best utilize the telemedicine technology to make healthcare accessible to those who do not have direct access to care.
That's right. That's a good summary.
Such a pleasure to have you. Thank you.
Thank you.
So you've now worked at NASA with a lot of healthcare organizations, physician organizations, providers all over the country. And with all that experience that you've had, what are your goals as you now consult as an advisor to various healthcare organizations across the country?
Well, I feel like I've had a very lucky trajectory in medicine.
Mm-hmm.
Early in my medical career, I mean, even as a medical student,
Mm-hmm.
I was exposed to some of the early rudimentary telemedicine applications that were going around. And then after I went through my residency and got to NASA, we were doing telemedicine back and forth to the spacecraft.
Mm-hmm.
When I was in mission control, the flight surgeon there is the only one whose expertise is the human system. So we were able to monitor our astronauts going 17,500 miles an hour around the planet. That's 5 miles a second. And if I could see a rhythm strip of an astronaut in a spacesuit going 17,500 miles an hour, why couldn't we apply the same technology across a distributed healthcare delivery system?
Absolutely.
And that's how I first got really interested in it. And then the other thing that happened too was, as a fourth-year medical student, it was state law in Oklahoma where I went to medical school. You couldn't graduate from medical school until you had done 5 weeks in a very rural setting. So my first rotation of my fourth year was at a little community hospital in Miami, Oklahoma, right on the Missouri border. And what really worried me when I got there was the attendings were very glad to see me. That was my first word, okay? Because it was a Friday night.
Yes.
And so they basically handed me the keys to the drug cabinet, and they went to the lake and said, well, if you need us, you might be able to find us at this number. And they gave me a number. So there I was, first rotation of my fourth year, and I'm sitting there in the emergency room waiting for things to happen. And this is back in the mid-'70s, so a van full of hippies rolls on Interstate 44, and the ambulances bring these people in. And fortunately, they were mostly in pretty good shape, but they'd been banged around. So I did a bunch of x-rays, and I'm sitting there as a fourth-year medical student trying to read all these x-rays. And I'm thinking to myself, why is it with all modern technology that I can't bring in some expertise to basically look over my shoulders to make sure I'm interpreting these x-rays correctly? So that was the real seed that gave me a real interest in telemedicine. And so while I was at NASA, I got, frankly, more passionate about telemedicine than I was about the space program. So I did a 10-year hiatus. I was at NASA 22 years totally, but I did my first 10 years, then I did 10 years of telemedicine, and then I went back to NASA for the last 10 years, last 12 years. And with that, my goal was to try to utilize the technology to improve medical outcomes across a whole distributed theater of, you might say, medical operations. One of the first things I did was establish a teleradiology network. You know, back in the old days, there were itinerant radiologists.
Yes.
That's what we called them, right?
Yes.
That would ride the circuit between the smaller communities in the state. And if you happened to get your x-ray taken the day before they got there, you were lucky. because you had a board certified radiologist look at your x-ray, do the interpretation, and then move on to the next town. If you were unlucky enough to get your x-ray taken the day after they left, you waited 6 days to get your radiograph interpreted. I thought that was nonsense. So we set up a teleradiology network in the state of Oklahoma, and this was back in the real old days. So we took a film that they could easily generate, run it through a digitizer, make it into a digital file, and we sent it to the major medical center there as part of the medical school in Oklahoma City. So we could get a read on the x-ray within about 30 minutes. This was a huge boom to healthcare.
Absolutely.
Huge. Now, the itinerant radiologists weren't very pleased about it, right? But they still would do the interventional radiology. We couldn't do that remotely. A lot of it we can do now, but in those days we really couldn't.
Well, technology certainly has come a long way.
Yes, it has.
And not only the technology, I would say even our operational oversight of how we use technology has come a long way. How do you think the basic paradigm has shifted or is evolving as how we want to utilize healthcare technology, specifically to help serve population, across rural areas or areas where they do not have direct access to it? How do you think that has evolved?
First of all, the big mistake most people make, and especially this happened in the beginning of telemedicine, was people just thought you could throw technology at the problem and it would fix the problem. And that was the worst thing that you could do. I remember hospitals buying these old digital video, interactive video systems, and they ended up after 2 months being very expensive paperweights. Okay, they weren't utilized at all. So you had to tailor the technology to the need. And the people that knew the need were the physicians on the remote end. They knew what they needed and what they didn't need. Okay? So you couldn't come in and offer all services. In order to get them to buy into the whole system and to buy into the concept, you had to be offering services that they really needed to deliver better care at the point of care.
Absolutely.
Which was at the rural end. Now, the advantage for the tertiary medical centers in those days was that patterns of referral followed patterns of consultation.
That's true.
Okay?
That's true.
And so if they could deliver some services as a loss leader and establish a relationship with the local medical community and the local patient, then when those patients had a condition that basically needed to be referred, that had a higher acuity than what could be delivered at the remote medical center, those patients were usually sent to the hospital that was providing these telemedicine services.
We're also seeing the trend that in addition to the healthcare systems or telemedicine being utilized within the clinics, more and more payers are incentivizing telemedicine access through apps as well.
Yes.
I certainly, as mom of 2 kids, every time we have an ear infection, the first thought in my head is, oh darn, I have to take half a day off.
Well,
but instead having an app and having that, a virtual visit is just so helpful.
In fact, telemedicine is one of those areas where the users were dragging the providers into the 21st century.
Absolutely.
Because initially, as I'm sure you can remember, there was a lot of resistance in the medical community.
Very much so.
The patients were all for it. It really helped them. It saved time. It brought better, faster, cheaper health care. But the physicians weren't in favor of that at all.
Well, let's talk more about the evolving role of physicians. You're here with us at Lumina Leadership Insight Series. I'm here with Dr. Jim Logan. Thank you very much. Stay tuned for our next episode.